Hello everybody, this is Joe with the Medicare Advocate Group. I hope you're doing good today. Check my mic here, make sure it's working. I've been getting an awful lot of people lately that have had end plans and currently on an end plan, and they don't know what the difference between end plan and the rest of the plans are. All they know is that an end plan saves them money. That's how they've been sold that product. It saves them money. What I want to do right now is just take a little bit of time and show you the difference between the end plan and my favorite plan of the Medicare Supplements. So hang on one second. I'm going to get rid of my face here. And again, I'm in the 2015 Medicare and You Guidebook. Again, that's your Bible. You always want to keep that next to you if you have any questions. But I'm on page 93 of the guidebook, as you can see up here, and all I'm going to do is scroll down to the chart, and this chart, I'm going to just read it. The chart below shows basic information about different benefits that Medigap policies cover. If a percentage appears, the Medigap plan covers that percentage of the benefit, and you're responsible for the rest. You're responsible for the rest. Now what I'm going to do, just let me scroll on down here just a little bit to get the whole chart. And here's the whole chart. Now the end plan right here, this is what I'm dealing with a number of folks here recently with. They have the end plan. And again, like I said, they know it saves them money, which I'm all about saving money. But I'm also about getting the biggest bang for your buck also. So let me go through this real quickly. And as you can see, here's the benefits over on the left-hand side. I'm going to start with this benefit right here, Medicare Part A coinsurance hospital cost. Plan N covers 100% of it. Now, my favorite plan is the Plan G. And if you look at the Plan G covers 100% of the Medicare Part A. Go down to Medicare Part B, Plan G covers 100% of that. But the Plan N's got 2 stars right here. It covers 100%, but it's got 2 stars. Well, what do those stars mean? Those stars mean when you go into the doctor, you might have a $20 copay. If you go to an emergency room at the hospital, it might be a $50 copay. The particular folks that I'm dealing with are having a lot of copays when they're going to the doctors. So it says 100% up there, but that's not necessarily true. She's getting hit, they're getting hit with a lot of $20 copays. So that's one thing. The Plan G over here, it does cover 100% of it with no stars. Let's go down to blood, first 3 pints. Plan G covers 100% of that. Plan N, yes, it does cover 100% of that. Part A, hospice care, coinsurance or copay. Plan G, 100%, which is great. Plan N, 100%, which is great. Skilled nursing facility care, coinsurance, Plan G covers 100% of that. Again, Plan N does cover 100% of that. Part A deductible, Plan G covers 100% of that. So does Plan N, which is fantastic. Now, this Part B deductible, a lot of people are not sure what that Part B deductible is. Well, what that is the doctor. So, if you go over here to Plan G, there's a blank here. If you go over here to Plan N, there's a blank there. Now, that Part B deductible is $147 right now in 2015. It could go up, could go down, who knows. But right now it's $147. By that being blank, the G plan does not cover it, but you are choosing to pay that $147 one time per year to go to as many doctors as you need to throughout the year. So once you pay that $147 one time per year, whether you go to the doctor one time, whether you go to the doctor 50 times, it doesn't matter. That $147 covers every doctor you go to. Now the trade-off on doing that is a lower premium. And it works like that with Plan G, and it works like that with Plan N. So let's go down here to the Part B excess charges. The Part B excess charges, Plan G covers 100% of those. Plan N does not cover excess charges at all. And again, a lot of folks don't know what the excess charges are. You may go to the doctor one day or go to another doctor or maybe a specialist, something like that, And the excess charges happen when that doctor charges more than the Medicare will reimburse that doctor for. That is an excess charge. That you're responsible 100% for. So the Plan G will cover those excess charges, whereas the Plan N does not cover those excess charges. Now let me go to the last one, and that's foreign travel emergency. Plan G will cover 80% of any foreign travel emergencies that come up, just like Plan N. That will cover 80% of foreign travel emergencies. So the Plan N, when you're younger, and when I say younger, if you're 65 to 72 or so, and you never go to the doctor, a Plan N might be okay. But here of late, I'm dealing with a lot of people who are 75 and above, and they're going to the doctor more. As we all age, we tend to go to the doctor more. The Plan G will cover a whole lot more than that Plan N will because of the excess charges and because of the copays that they're paying on that Medicare Part B. So I can see folks when they're a little bit younger, 65 to 71, 72, getting into a Plan N that never go to the doctor. I understand that. But as you get a little bit older, 63, 64, 65, 66, 68, chances are you're going to be going to the doctor more. That's more out of pocket for yourself in that Plan N, whereas that Plan G would cover all that. Now let me give you one example. In the Plan N, the lady I gave her a quote for was $101 for the Plan N. That's just to replace her one Plan N with another Plan N. Right now she's paying $252 a month for her Plan N. We can get it all the way down to $101. She's already passed the health questions, so I know she'll get approved for that. So I showed her the Plan G, which covers more, takes the deductibles away, and takes the exposure to the Part B excess charges away. The Plan G came up to be $113. So for only $12 more, she takes away all her copays, and she takes away the potential excess charges that could run into a whole lot of money once you start going to specialists. So for $12 more, she's got a better plan, and it covers more that she's not spending so much out of her pocket on. Now, a lot of folks ask me about the Plan F. As you can see right here, this Plan F, they call this a Cadillac plan. A lot of folks are moved to that plan. It does cover everything, but it comes at a premium, a lot higher premium, because you're letting Medicare and the supplement company take care of everything for you. Everybody knows how to write a check, which is what this Part B deductible is. You choose to pay that check yourself, you can drastically reduce your premiums. Whereas the Part B on the Plan F, they pay it for you, the supplement company pays it for you, they're going to charge you a lot higher premium for that service. So if you know how to write a check, you need to write it yourself, get yourself into a Plan G, take the copays away, protects you from the excess charges. You choose to pay that doctor deductible $147 yourself. One time per year, covers every doctor you could possibly go to that one time of the year. You got yourself better coverage, you got yourself a much lower premium. So I just wanted to comment real quickly on the Plan N versus the Plan G, and I appreciate your time. If you need an independent insurance license agent in your area, we'd be glad to help you out. This is the Medicare Advocate Group. You can reach me on the contact information below. I appreciate your time. Everybody have a good day.